This is Adam Bartley. He's on his way to pick up his medicine. After years of being forced to the black market, now he can do it safely and legally.
Howdy, howdy. When I or any of the other patients call and make an appointment, their security greets me at the door, checks the IDs, and then will allow entrance into the building. How are you today?
Well, welcome.
Jeff Kahn owns this dispensary, which just opened after 3 years of competing for one of the city's 4 dispensary permits.
Jeff,
Good to see you again. And your bike.
There's been little business so far, but Kahn is not discouraged.
We want people to be able to know what they're getting, to be able to make wise choices, to be able to be helped to choose the right medicine and to be able to use it safely.
Can I see the fact sheets?
Absolutely.
Because I've been HIV positive for 23 years and lived with AIDS for many of those, I've taken a great deal of medicine. Many of the medicines still cause a great deal of stomach discomfort and lack of appetite and nausea. In the early 90s, had I not had access to marijuana then, I likely would not be in the good health or perhaps even alive.
While medical marijuana is legal here in Washington, it's still illegal under federal law, so the city is being very careful.
Every part of the medical marijuana program is under camera, under lock and key, and fully recorded from seed to sale.
And for potential customers, getting a medical marijuana ID is not simple.
It requires that you contact the Department of Health only by email. It requires that you be able to download, print, and fill out a lengthy application and provide documentation and a passport photo. There's a $100 application fee.
But before any of that, you have to have cancer, HIV, AIDS, glaucoma, or severe muscle spasms to even qualify. And a doctor has to fill out another lengthy form recommending you. Sakaliba Mines is one of the few doctors in the city who write recommendations, but she says she was initially cautious.
We cannot reproduce what's going on in other states where, doctors, all they do is write a recommendation, the patient is out the door for the year. I don't think that's good medicine.
No, you should stop the weed, too.
Dr. Robert Dupont has advised several administrations on the issue. He says it would make more sense to refine marijuana into medication instead of smoking it. But he's fine with the way the city's handling its program.
I think a limited program that ensures that the people are really ill and that they've tried other treatments, and it gives them an amount of marijuana that is reasonable for them to have and not to sell to other people or give away, I think is a very good political resolution.
So this is the 1/4 of an ounce of the Master Kush.
Today, only 28 patients have qualified for the program, and that's not really enough to support the system yet.
And last but not least,
today's dose, 10.5 grams, costs about $200, and none of it is covered by insurance. But Adam is happy to support the local economy and to get his marijuana through legal means. Tala Hadavi for VOA News, Washington.